And we're live. Hello, it's me, Dr. Toomer Talks on Tuesdays. And um and if you're watching, please introduce yourself, say hi in the comments. We'll say hi right back. And if you're watching later, please put hashtag replay. Well, today I'm here with Dr. Ngozi Ude-Oshiyoye. Said it right?
Yeah, got it.
Okay.
Dr. J for short to keep it easy for you.
Oh,
Got
well, I have a daughter who does not allow me to shorten names. So,
oh, you're like, okay, I gotta get it.
uh, no, but I just because I was saying your name, Loze, and I was like, I think I'm pronouncing it East African because I grew up in Kenya.
You
So
got it.
anyway, so we are here today with an extraordinary doctor who is a family medicine physician who founded her own practice, who also does aesthetic medicine. She and I both feel it's very, very important to empower people in their processes of getting healthy. And we are going to talk a lot about that today, but we're also just going to talk about wherever we go. And I'm going to let her introduce herself and just kind of give you an idea of who she is, and we'll get into this afterwards. So go
Awesome.
ahead, take it away.
So much, Dr. Toomer, for having me. This is awesome.
Um,
So, um, hi everybody. I'm Dr. Ude. I am a board certified family medicine physician. I'm based in Martinsburg, West Virginia. I own a primary care practice actually with my husband, and namely Apple Valley Family Medicine. And I also own an aesthetic practice. And with both modalities, my goal is to have my patients not only feeling good, but looking good.
Well, that is, I think, something that we share in terms of what we want for our patients.
Mhm.
And we've talked quite a bit about how we like using a holistic approach and making sure that all things are addressed, the biology, the psychology, and the sociology, and everything that's being done. So let me ask you this. What would be considered um, your ideal patient? Or just someone that you would want to come in, and if they did come in to see you, what would they expect?
Because we're primary care, I do see of the full gamut, which is, basically newborn all the way up to age 99 and beyond.
Mhm.
Um, but I would have to say that women are near and dear to my heart. So I would say a good number of my patients would be young working moms. Again, I see everybody, but as far as those coming to me, I usually do quite a bit of coaching with, even though it's just in the primary care setting.
Mhm.
Young, busy working mom, you know, wearing all the different hats, stressed out, taking on a lot, who is trying to make sure that they're living their best life and trying to figure out and get that balance, and live their life well. So that would be an ideal patient that I would see on a day-to-day basis.
Okay. And now we talked a little bit, and I read in your website that you're very adamant about empowerment.
Yes.
And so, and of course, I understand why it's important to feel empowered. So why don't you tell us a little bit of why it is important to feel um, empowered in your health process, and then what would happen if you don't seek that out?
So I would use the context of, women and working moms just because that's basically me, right? And obviously, I'm a busy working mom, and I have experienced, burnout and experienced imbalance in my life. And so, with having the medical training, but also being on the other side of trying to figure out how to put it all together and live the life that I think I should be living. It was definitely difficult at the beginning. I feel like my life, I've always had purpose.
Mhm.
So
Yes.
I could remember I knew I wanted to be, a medical doctor. And
Mhm.
so that filled the purpose part. Obviously, when I started that journey, I wasn't married. I hadn't had kids at that time.
Mhm.
So by the time, I built my career and then added the family and personal component to it. trying to make sure that I was being purposeful, but also finding peace and joy was a big deal.
Mhm.
And I found it difficult. It's much better. I think we're always improving, but I think once I felt like I've gotten better and figured it out,
Mhm.
then started kind of seeing that in my patients, in the patients that come in to see me. And
Mhm.
I find that we women, I mean, God bless us, we're amazing, I think. We juggle so many hats, mom,
Mhm.
business, working both inside and outside the home, um, taking care of our parents, and the list goes on and on. And so sometimes, I'll have a patient that comes to me and, they're talking about, I'm feeling anxious and I'm depressed, or there's other things going on. And sometimes when you just look at it, it's just, wow, look at all these hats that you're wearing.
Mhm.
And so it's helping them see that, look, you're not alone. There's nothing wrong with you. And that's that, getting them feeling empowered that, this is not a weakness. It's
Okay.
just out that, you're taking on too much, even for, an amazing empowered woman, and getting them to step into that role and take the bull by the horns, if you will.
Nice. So I have a question then. You also do aesthetics, is that correct? Okay. So my first question is, what exactly is aesthetics?
So to me, from my perspective, it's,
Mhm.
to be honest, beauty from the inside out. That's the
Yeah.
way I see it. So
Mhm.
because it doesn't matter, what is done on the outward appearance. Like if you don't feel beautiful,
Mhm.
matters. So for me, I see it from my perspective is helping the patient feel good on the inside, and then using, you know, aesthetic modalities, as you will, to
Mhm.
help them feel good on the outside or look good on the outside. So
Mhm.
as far as I provide would be Botox filler,
Okay.
um, body sculpting,
Okay.
laser. So
Mhm.
that's my definition of it.
Oh, okay. So when you say body sculpting, what type of machine? Is it a machine? Is it how does that work?
Yeah, so the machines that the services I provide would be True Sculpt and Smart Lipo. There's
Okay.
a plethora of services out there. So the ones I do provide is True Sculpt. True Sculpt is non-invasive. It uses radio frequency to melt fat, and
Mhm.
so it's those services that I have people come in at lunchtime and get that service and go right back to work. Smart lipo is a little bit more invasive, but there is no general anesthesia. And so in that case, we use a laser lipo,
Mhm.
um, and we make little ports, and we're able to melt fat, suction, but the
Mhm.
patient is awake for the procedure.
Oh, okay.
Mhm.
So what do you tell people when they say, "Well, this is just vanity." Why would you do that? Just accept your body for the way it is.
So I disagree. I mean,
I disagree too, but I'm just why I'm handing it to
right.
you
So
because I hear that a lot with weight
I
loss. It's always like, that like somehow wanting to lose weight and having body positivity are somehow not the same and they can't be together in the same space. And so I was asking you that because I know
yeah,
you don't you're like I do. You
yeah,
believe that it's
oh, absolutely not. I would say, especially, I always talk about women because a lot of my clients are women. I
Mhm,
mean, we have every right to look and feel good. I feel like they're interchangeable because
mhm,
it's, to me, it's actually more of a perception on how you feel about yourself. So if you have something that, you look at and it makes you unhappy,
mhm,
or for example, you've had children and you're trying to get help to get back to where you feel comfortable, because again, it's more how you feel, then I don't think there's absolutely anything wrong with it.
yeah,
You only get one life to live, so you might as well live the way you want.
the
And you
way
have to feel, yeah, you have to feel the way you want to feel. So I think it's a personal experience. Everybody's entitled to their opinion, but I don't think it's vanity at all. If it makes you feel good and makes you happy, why
Mhm.
not? Why
Exactly.
not?
Well, hello, Tawana. Thank you for joining us. And
Yeah,
if anyone else is watching, say hi. Um, and so, when it comes to family medicine
yes.
and sort of looking at the whole person and trying to improve, um, what do you say to people who say, "Well, I just want a pill. Just give me a pill. Stop trying to fix my life. Stop trying to fix my car." Just fix that one little thing that I want and send me on my way. Before we you answer though, I just want to say hi, Tanya. How are you?
I'm there. I'm here. Okay,
Okay.
so I heard the question, and
Mhm,
that is a really, really layered question. But
mhm,
I think it all connects.
mhm,
Unfortunately, just giving you a pill to me doesn't cut it. Because something as basic as stress, something as basic as sleep affects you on so many levels. So just getting a pill, it can only get you so far. So that is why it's so important to treat the whole person. I'm a proponent, I'm a believer in prevention is definitely better than cure. Now,
yes.
obviously, once you come to me and you've already had certain things happen, I will do my best to get you um, as well as I can. But just seeing how much of an effect that sleep can have on the person's or a patient's well-being,
Mhm,
it all these things even affect you on the cellular and hormonal level. So
mhm,
stress, obviously, how your cortisol levels affect
yes,
um, people's ability to lose weight. How sleep, when you sleep, you get high levels of your, at least the highest levels of your growth hormone, which is your reparative hormone. So to me, I want to utilize everything that is available to me, and I feel
mhm,
like naturally, when you do all the preventative things you're supposed to do, you
mhm,
get further than if you're just getting, pharmacotherapy. So
mhm. Well, I have 2 questions then. Now, 1, does someone have to be your primary care patient in order to be an aesthetic patient in
no,
your
those
okay.
can be expensive. Yeah.
And if, someone were to try and make an appointment with you, about how long would it take before they could see you as a primary care patient?
So we're doing pretty good with that. We do actually take walk-ins. So I think it's about a couple of weeks.
Okay,
But a lot of times we're able to get people in within a few days.
okay. That's actually
Yes.
pretty good.
Yeah.
Yeah,
We're
that's
doing
a that's almost urgent care.
pretty much. We take walk-ins. So we really do work on being accessible to our patients. And we're also open 7 days a week. So yes.
Okay. I just wanna say hello to Shay Smith, who's just joined us. Hi, Shay. Um, and so what do you do for your own wellness?
Mm. So all the things this I kind of alluded to some of it, but
Mhm,
a big one is trying to make sure that I'm getting enough sleep. A big one is trying to stay hydrated.
mhm,
A big one is taking time for myself. So me time. I'm an introvert, so I do recharge my batteries by um, taking some me time. We just came from a recent entrepreneurial conference,
yes,
so
that was great.
plugging in with like-minded people.
Yes.
So feeding my mind. I was actually just listening to a book before I got on. So reading,
Mhm,
um, definitely spending time with those that matter to me. So my children, my husband,
mhm,
um, my sisters, my parents, just like everybody else. Physical activity. So I do try to lift some weights. I'm doing some strength training and then treadmill. So
mhm.
um, it's tricky to fit it all in, but I do
Yes,
find a way.
it is. Did you figure
So
out a way?
yeah,
So, Shay Smith says hello to you directly. I don't know if you can see the comments
I
on your
can't.
okay. Yeah, well, Shay says hello. Um, and so when trying to When trying to get your patients to understand how important wellness is for their health, what ways do you do that? I think
Mm.
most of the people who work with me know what I do, but I want to hear what you do to help people with their wellness.
So it's tricky because I think it also depends on the person or the patient.
Mm-hmm.
But I do let them know personally what I do. I do talk to like and just like what I said, listing all the things that I do personally. Because sometimes patients think that you just because you went to medical school and you have it all dialed in and you don't have the same issues of time management and things like that.
Mm-hmm.
So I definitely use myself as an example. As we usually are very busy. um I do talk to them about, I kind of go ahead and talk about the things that could happen if they don't turn things around. So
Mm-hmm.
unfortunately, so if I have a patient that has diabetes that's not taking care of it, then I do explain, on, the with scientific, as far as what's going to happen. And then I
Mm-hmm.
obviously that picture because I have patients that are there, amputation, blindness, you know, um, end stage renal disease. So I kind of go forward and kind of give them an idea of what could happen and then cycle back and say, hey, you know what, we could back up, especially like patients, maybe they're pre-diabetic, that we can actually completely reverse this. The other thing I do is then talk about the things that they can do, which is the lifestyle stuff I just talked about. And then I also then offer, what I have to offer as far as medications. So it's kind of painting the picture, going back to say this is the possibilities, and then this is what's available.
Okay. And I know, and so I walk in the door, I fill out your
Mhm.
paperwork, and I
Yes.
sit down with you. And so how often do you'll see me, let's just say see me, you live in different states.
No.
How often do you recommend someone see you? And how often do you get, I'm just gonna say accused of having people come back because of payments?
So you said come back because of payments. Like, what do
Yes.
you mean? Follow
In
up
other
appointment?
words, I guess my question really is, how often should someone expect to be told to come back to see you based on what it is that they're coming to see you for initially?
Absolutely. So it depends on the patient. It depends on their medical conditions. So I kind of picked
Mhm,
diabetes. So for a patient that has diabetes, if their blood sugar level is not well controlled, it would be every 3 months with lab work. If it's well controlled, it's every 6 months. Now, for a patient that doesn't really have, any significant medical conditions, which is great, which is fine, it can be once a year. So it really depends on the patient. My blood pressure patient's similar, Now, if, their blood pressure is 200 by, 100, then I'm probably going to be seeing them, within a few days to next week. So it really
okay,
depends. But on average, it's 3 to 6 months. And then if they're on stimulants, or let's say I am treating anxiety or depression or something that is a little bit more acute, then it'll be every 4 weeks.
okay. I'm just gonna say hello to Chris, who has joined us. I was wondering where you were. Chris joins us every week, so I was wondering.
Oh, that's
So, um, well, if there's anything you'd want to tell people, what makes you unique? I mean, there's a lot of family doctors out there. What makes you so special? I know what makes you so special. But you tell us what makes you so special.
So, I think what makes me unique is I think that perspective of understanding how important women are,
Mhm,
how hard we work, how many hats how great multitaskers we are.
mhm,
And so, like I said, we women have a special place in my heart. And so, um, I with that in mind, I usually do a lot of coaching, actually, even with my primary care patients to help, especially my female patients, to stand in their gifts and
mhm.
stay empowered.
Okay.
So and I actually do weight loss as well. So with, you know, helping patients medically with my primary care practice, helping them lose weight and helping them with aesthetics.
Mhm.
Um, that's, something extra that I bring to the table.
Okay. Well, for those of you who are listening, if you can just put in yes if you can hear me. I think our mics are going in and out, and I'm not sure if you can hear me and hear us both. Then could you just let us know so we're not sitting here looking like ventriloquist? Okay, good, good. So you can't hear us. So, now, do you only help people in your area, or do you have any type of telehealth services?
Yes, so we do telemedicine.
Mhm,
So absolutely, people can call in and get virtual appointments. Um, a lot of patients that either move out of state or go out of state for work, a lot of them actually stay on with us, and they're like, I'm
mhm.
going to stay with you till I find somebody in my area. And a lot of times they don't find somebody for a while, and it's fine. So we love our patients. So yes, definitely virtual is available.
And so if someone wanted to contact you, what should they do?
Yeah, so they can either get on our website, which is www.applevalleyfamilymed.com. Um, they can call 304 And I actually have a podcast that is called Weekly Dose with Dr. Uday, where I talk about varying medical conditions or concerns. And I have specialists and other doctors come on to share tips. And so that, you can get anywhere you get your podcasts. But say definitely iTunes and Spotify for sure.
Okay, I'm just writing that out so people can. You
Oh,
said weekly dose with Dr. Ude, correct?
correct.
Okay,
Yes.
so let me add that and show that. And
Mhm.
there we go. So that's her podcast. So if you'd like to listen to more, listen to other doctors, listen to her, find out more about how to contact her. Um, we This has been absolutely fantastic, and I really appreciate you coming on and joining me here, especially since um, we're needed. In
Yes.
family medicine, we need people who truly care, who truly listen, who truly embrace their patients. And I thank you very, very much for coming on and sharing that with us.
Oh, thank you, Dr. Toomer. This was awesome. Thank you.